Hi guys, this is Dr. Denny Warren with Generations Health and Wellness Center in Fayetteville, Arkansas, and I wanted to share with you why we have and why we take x-rays of patients. This is our digital x-ray machine right here, right behind me, and it's all that comes up on the computer monitor there. But we have these things for a specific reason, so we can see exactly what's going on inside your spine before we do any adjusting. Now, when we first started in practice 7 years ago, we didn't have x-rays because every time you take an x-ray, there is a little bit of radiation with it. CAT scan, that has probably the most radiation. So if you go to a dental office, they're taking little bite wing x-rays of your teeth. That probably has some of the least radiation. But every x-ray you have does have some radiation with it. And at first, when we first started in our practice, we did not take x-rays at all because we didn't like the thought of radiation being around us. But we learned through going through hours and hours and hours of education and learning how to actually restore proper curves back in our spine. If you have scoliosis, helping to restore that back as best we possibly can. By doing those things, you can actually stop and prevent degeneration or arthritis. And so we started to take x-rays because first of all, we didn't know how people's curve in their neck was. Do they have a good curve? Do they have a loss of curve? Or do they have a complete reverse curve? Because if they have a loss of curve or reverse curve, their spine, every step they take, they're pounding down on their spine. They're causing their spine to degenerate and to rot at a very fast rate. And so now we know how to actually improve that and correct that so we can stop that degeneration. If they have scoliosis, as gravity pulls down on them, they're going to have uneven wear and tear, uneven stress, and bone spurs and arthritis. And so we need to be able to measure and see exactly where you're at. If you have scoliosis, we want to see what degree you're at. That way when we start treatment with you, we want to actually go back and take x-rays and see what improvement, what change we've had with that scoliosis. That just ensures that we're on the right track and we're moving in the right direction and your body and your spine is getting healthier. That's what we want to make sure of. Because there's a lot of things that you can tell. Again, when we didn't take x-rays before, there's a lot of things I can tell what areas are fixated just by feeling with my hands. But I don't know what areas have bone spurs and arthritis. And I'm going to show you these models real quick. This right here, this is a healthy segment of the spine where the disc between the bones are nice and tall, the bones are nice and smooth. And if you look at that, this yellow thing coming out right here, that's the nerve. And if you look at that hole where that nerve comes out, it is wide open. That's what you want to see. Now as you go along here, you can see from here to here, the disc is actually thinning out. But if you continue to pound down your spine without having proper alignment, it's going to degenerate more. We've all heard of bone spurs. This is what bone spurs look like in your spine. I can't tell that unless I take an x-ray if you have this. I've had a 14-year-old who's had bone spurs in his spine. I've also had a 91-year-old who's been perfectly healthy, no arthritis at all. So arthritis is not due to old age. But if this goes on, it continues, it could turn into this one right here. This is where the bones are completely fused. And the most detrimental thing here is, look at the hole where that nerve comes out. I don't know if you can see that on the video, but that literally is pinching down, choking off that life flow through that nerve to your body. And so that can bring about disease, that can bring about illness, that can bring about all types of symptoms throughout your body. So x-rays help us identify where you're at on this scale, and then we can give you a specific treatment plan to bring you back towards this direction and maintain that, most importantly, maintain that for the rest of your life. And for those of you who are concerned about the radiation, I was too, and I still am. There's still things that I do currently every single day that help me protect myself from that. So one thing you can do is eat a lot of apples anytime you have x-rays before, and eat apple a day for several weeks after. Apples are very high in a mineral called boron, and boron helps to bind to that radiation, actually cleanse it out of your body. It's a very good thing to do. Seaweed is another excellent example of something that will help to cleanse your body out, clean your body out of all the radiation. Of course, fruits and vegetables, dark leafy greens, really, really good. So do those things anytime you have x-rays. Dental x-rays, x-rays here, if you have to go to the emergency room, all of those things. Eat those foods that's going to cleanse your body out. Now it'll take away the damage and help repair and heal your body. And so I hope that helps you understand why we take x-rays, because we need to know exactly where you're at. And even if you feel good, you don't know where your spine is at, because you can go into the dentist and they can probe around with a tool and they can make sure that everything looks good, everything feels good with the tool. But if they take an X-ray, they might actually find cavities, and you might not have had any idea that you had a cavity in your teeth. Same thing with your spine. You might not have any idea. You might have some good range of motion. You might not have any symptoms or pain, but you might have arthritis, bone spurs going on in your spine and not have any idea. So that's why we take a picture, so we can get a baseline of where you're at, and then we can give you a game plan to improve it and to keep your spine healthy for the rest of your life. So I hope that helps, and I'll see you in another video.